our heart is the driving force of our body, and we know how much importance we have to give it. So, doctors, can I ask you something? Suppose a patient comes after a cardiac arrest or a heart attack, and he underwent all the preliminary treatment. So after that, in an Ayurvedic point of view, what can we advise or what treatment can we do for this person?
Usually, if a patient is coming followed by a cardiac attack or heart attack, he will be under severe stress, because up to that period he was normal. Followed by that period, he is abnormal, because he is a cardiac patient in the lifetime. First of all, we have to approach him with a confidence, because followed by the cardiac procedure, he is not a cardiac patient actually. Because followed by the cardiac intervention, there was a problem in the blood supply, and that problem was addressed with some stent or some angioplasty by emergency measure. Followed by that, he is actually normal. Only one problem existing is further possibility of further cardiac issue. Second thing is that due to the reduced circulation to the blood vessel, circulation to the muscle, there will be some existing inflammation, and gradually that will end up in a weakness of the muscle. So he will not be able to climb the stairs as previous. So that has to be addressed, and we have to increase his confidence. That is actually to be done. That we can do. We can use our own medicines, and we can improve his cardiac muscle strength. And we can give medicines, we can give advice, exercise, yoga protocol to protect him from further cardiac issue. That will be better. Okay, that is a thing which we can do in our clinic setup itself.
How about in Siddha? What type of Siddha management can we do?
Same, the biggest problem after a heart attack or a heart condition, the patient get panic. That's the biggest fear in OPD. When they came inside an OP and they say, I am a cardiac patient.
So we have to calm them down first.
That's important thing.
Yeah.
Calm down, give confidence. Everything is disturbed, like sleep disturbed, their exercise pattern change, their diet change. So these are all we have to take care. That's very important. So more than curing the heart disease, we have to take care of them. Sometimes we have to educate the family also.
We should
support the family, support the patient. Maybe they have to support a patient by he's working hard. You have to shift the job also. So there are a lot of things we have to involved. So that's the biggest thing, more than treating a heart disease. That's the best. Doctors are familiar with that.
Recent times it is coming very early, like 32. I had a patient of 26 years of 26 on his 26 years, 26. He had a massive attack, inferior valve massive attack. He was almost gone, and he came back. So what is the situation? He'll be very much down. So we have to improve his confidence level, and we have to give sufficient medication, and we have to back him to absolutely normal life. That we can do with our medicines and the procedures.
Sometimes acute we may not manage. Definitely we have to shift it to good hospital. Emergency condition is important. After that, post cardiac scenario, we can manage it or we can revive it easily. So, but taking care of the whole thing is important.
We have to deploy specific medication for that. Simultaneously, we have to evaluate the patient very properly, because when we are attending a patient of this much scenario, we have to evaluate all the reports like his angiogram and angioplasty, how much stent is deployed, what is the length of the stent deployed, and what is the length of the block he had, all these things. And what is usually a patient will be there with the 1 or 2 stents, plus other 2 or 3 vessels will be there with the block, but it will not be properly addressed. Because at a time we cannot, if it is a cardiologist, they cannot deploy a lot of stents, because his heart will be completely mechanical. So that will indirectly influence the dynamic activity of the heart. So minimal stent will be placed, but majority of the vessels will be there with the further blocks. So that will be gradually developing, and he will be under the stress of again the cardiac issue. So we can deploy our exact medications, and we can reduce the block level gradually. Simultaneously, we can protect the stented vessel, not to clog from the platelets. So actually, we are taking him back. Otherwise he is advised to take lifelong medication, and he is under horrible stress. Plus, from that particular moment, he is a cardiac patient. So he will be addressed with the sympathy. He will be under some specific care. That will be a very severe situation. Actually, that is not required, because once it is treated, and if he is able to cope up with the proper treatment, he is back to normal 100%. That is what is possible through Ayurveda and Siddha methodologies.
It's because, coming to our basics, Vadam is the main cause for this Vadam and Pittam. The rearrangement also causes this kind of things. So, to normalize Vadam, Pittam, Kapam is our focus, to balance all the things. For that, I had to increase the digestive power. Digestive power to increase. Sometimes to improve the circulation, we have to improve the quality of blood. So, iron containing medicines, some herbs, decoctions, legumes, we have to give it. So that's also important. Their exercise, their sleeping pattern, their emotional support, physical things, everything involved in this cardiac.
So all basic requirements should be done.
That's
how we can support this person. Right.
Then
Manage, and we have to support him with sufficient evidence of the treatment also. Followed by the treatment or the due course of treatment, we have to do further evaluations as concerned with the previous situation, and we have to assure him how much block is reduced, how much activity of the heart is regained. Then only he will be having proper confidence, and he will stick to that procedure.
Right.
Otherwise, he will skip away. Okay.
So like a mental support.
Mental support with sufficient evidence.
periodic monitoring with modern support, and our medication is very important for that thing. After that, the diet, exercise, yoga, that's important. Diet is also important thing for water reducing food. You have to take it. That's very important. Then Tokkanam and Panchama, sometimes ovulation is important for the balancing Vadam, Pittam and Kapha. So altogether, end of the day he will be okay. So
what type of oils you can use?
To balancing Vada, but that's important thing to control the Vada thing. That type of oil, but medicine will be prescribed by the doctor. That's very important. That's the thing. Sometimes it's not good for them to choose by itself.
Oh, we can't generalize.
Generalize.
It
That's
should be particular for each person.
Individual patient to patient, it is different. We have to evaluate him very properly, and we have to plan the treatment protocols accordingly. Basic objective of the treatment is to restore his balance, Vata, Pitta, Kapha balance, Dosha, Dhatu, Vriddhi, all those things to be corrected properly as Dr. rightly pointed. Then there is less chance to improve, less chance to again regain the condition. He will be permanently better.
Improve the blood quality, digestion, fire, circulation. This area we have to focus. That's
So the digestion is actually very important for heart health.
absorption, everything is.
Due to improper digestion only, improper blood is formed. Improper blood is forming lot of problems inside the body. Example, cholesterol, simple cholesterol. Once the proper digestion is there, there will not be dyslipidemia. There will not be dyslipidemia. Lipids will be there in the blood. Definitely it will be there. But the derangement in the lipids is a product of improper digestion. So that is gradually ending into a cardiac issue. As the doctor said, it is very clear. Other than these conditions, other than block and all the other conditions also can be managed.
So what does yoga and pranayama have to do with this digestive power and in the end heart power also?
Basically, our body vayu is continuously moving through in and out. It's moving. So with pranayama and exercise, the circulation will improve. Remove the toxins, improve the circulation. So that's the simple thing with the yoga and everything doing.
Pranayama, as doctor said, when we do exact pranayama, the life force to the cell or the quality of oxygen or quantity of oxygen to a particular cell, in each and every cell to the body is increased. Body is actually composed of lot of cells together to a organ and organ systems to the body. So once the basic unit of body is always a cell. Oxygen supply to the cell is improved means definitely the cell will start proper production, proper functioning of cell. It will gradually end up in a whole wealth or whole healthy body.
So, in your opinion, should yoga meditation always be monitored, or it should be under a specific guidance?
Definitely. Whatever the exercise, it's important with an advice. So, without doing it, sometimes it's exaggerated and affect the cardiac muscles and everything. So, with a monitoring or with a physician or any yoga teacher, it's important. With a controlled manner is important in the early stages. After that, it gradually improve.
So, what are the medications used in Ayurveda and Siddha medications and treatments that we can use for treating heart attack?
For post heart attack status or post ischemic heart disease status, we use medicines to pure the blood. Rakta Shuddhi, that is the term which is used. Blood purificatory medicines can be used. Like our product, Hriday Shanti, can be used because it will effectively control the bore of the blood vessel. Like it will increase the bore diameter of the blood vessel if you are using regularly. Gradually it will increase the blood circulation to the heart, and gradually it will end up in a normal BP level also. Like other medicines also can be used. Siddha medicines are also there. Okay.
Say, Marudam Bhatte Churnam, say from Siddha medicine, it's strengthen the cardiac muscle walls actually. So again, that support the cardiac walls also. Stringy Barbam, it's a Basmam, it's a Papam, it supports the cardiac muscles. Same our product, Arjun 4, it's a capsule. It support cardiac functioning, BP and everything. That's simply.
So, what about the external therapies?
Followed by same situation, followed by cardiac event status, we will admit the patient in a hospital and we will deploy external therapies like Sthanika Vasti, especially that is a Vasti procedure which is done over the heart area, plus Sarvanga Abhyanga, like procedures also done. That will improve altogether cardiac activity, cardiac tonicity. It will give a very good result to the cardiac patients in long run.
So, increase the blood circulation through Panchakarma.
Not only blood circulation, definitely it will increase the blood circulation. Along with it will increase the proper functioning of the heart. That means the cardiac cycle it will regularize. Timing of the cardiac cycle can be regularized with such therapies effectively.
In Siddha, it's almost same like Ayurveda, ovulation, so balance Vadam, Pitam and Kapha. Some specific treatments for the heart, maybe it with herbals and some other paste application over the chest region. It depends on patient, it changes, but we can manage it. That simply say that we can manage it, cardiac issues. That's it simple.
So, with this conversation with these doctors, we can come to the conclusion that through Siddha and Ayurveda, we can effectively manage heart problems and heart diseases.